Hi, in this video I'll talk about thyroid and its problems. How a patient with thyroid problems presents to you, how you diagnose him or her, and what do you do for them. All of them in summary. The thyroid gland has origin at the back of the tongue, comes down and sits on the thyroid cartilage. It has very important anatomy because in both sides there is recurrent laryngeal nerve and parathyroid glands posteriorly. It basically produces two important hormones, which are T3 and T4. Whenever there is a problem in thyroid gland, there will be a problem in these hormones that leads to clinical signs and symptoms. Most common diseases affecting this important endocrine organ are hypo and hyperthyroidism. Let's see what's hyperthyroidism. Hyperthyroidism is simply when a thyroid gland produces extra amounts of its hormones, either because the tissue of the gland has a pathology or because the hormone that stimulates the gland, which is thyroid stimulating hormone, has a problem. Let's assume that the gland has a problem. There's an enlargement of the gland, which sometimes called goiter. So it starts to produce more hormones, easily detected when you send thyroid function test. You will find that thyroid hormones are raised, so you can diagnose hyperthyroidism. But you may ask, how do I know when I need to send thyroid function test? Sure, a good question. You will send for the investigation whenever there are signs and symptoms of hyperthyroidism. And what are they? Basically, thyroid hormones have significant role on your sympathetic system. So when there's excess amount of them, there's stimulation of the sympathetic system, by which there will be palpitations, increased metabolism that leads to weight loss, insomnia, and anxiety. And when you examine the patient to search for signs of hyperthyroidism, you may find tachycardia and hyperreflexia and lead lags. So now we know that this patient has hyperthyroidism. But what causes it? Graves' disease, nodular thyroid diseases, and thyroiditis can cause it. Graves is the most common, which is an autoimmune disease, simply that there's autoantibodies that look like TSH and stimulate thyroid to produce hormones. So there will be hyperthyroidism. How do we know that someone has Graves' disease? With the same points we talked about them, and with investigation we can find the autoantibodies. Pretty easy. Also, there may be formation of nodules that produce excess hormones, or maybe there's infection, thyroiditis, that causes hyperthyroidism. I'm pretty sure now you can identify a patient with hyperthyroidism. Congratulations. And for treatment, you can prescribe antithyroid drugs like carbimazole. Also, we have to prescribe drugs for symptomatic treatment. However, you can treat it with radioactive iodine therapy or surgery. Now what about if thyroid couldn't do its job? What will happen? You guess it? Yeah, well done. Hypothyroidism. It's an easier subject. The most common cause for someone to develop hypothyroidism is called Hashimoto thyroiditis, which is again an autoimmune disease that causes fibroids and atrophy or goiter in the thyroid gland, which is enlargement of the gland. This is called primary hypothyroidism, which is caused by a problem in the gland itself. And this type is common rather than the problems in pituitary gland that may lead to decreased TSH and then decreased thyroid hormones. The clinical symptoms of this condition are nearly opposite for hyperthyroidism. Now, this patient may gain weight and become fatigued, have low moods and may be depressed, constipated and bradycardic. Whenever you see such presentation, you send for thyroid tests. Easily, the thyroid tests will show you that there is decreased amount of thyroid hormones, so you can diagnose primary hypothyroidism. However, to know what is exact cause of hypothyroidism, You can send further investigations to see if antibodies are raised. Then you can decide that this disease is caused by an autoimmune disorder in the patient, which is in this case Hashimoto thyroiditis. Now again, congrats! You diagnosed this case, and now simply by giving thyroxine replacement therapy, you can treat the patient. The last thing that we will talk about in this video is subclinical hypo and hyperthyroidism. So in these cases, the thyroid hormones are normal. When you send the investigations, you see normal amounts of thyroid hormone, both T3 and T4. But the problem is in TSH, thyroid stimulating hormone. In hypothyroidism, there's elevated TSH. And in hyperthyroidism, there is decreased TSH levels. However, in both cases, T3 and T4 are normal. So basically, that's it. Next, I'll put some cases so you can test yourself and know if you can diagnose the patient and treat them or not.